What is a TIA mini-stroke? Signs and recovery. Welcome to the U.S. Health Guide, where we provide reliable health information to help you make informed decisions. Imagine a sudden moment. You might experience an unusual numbness on one side of your body, or your speech might become slurred. But then, as quickly as it appeared, the symptom vanishes. You might brush it off, thinking it was just a fleeting, insignificant incident. However, this experience could very well be a transient ischemic attack, or TIA, commonly known as a mini-stroke. While the term mini-stroke might sound less severe, it's crucial to understand that a TIA is anything but a minor event. It is an urgent and critically important warning sign, a clear signal from your body demanding immediate attention. The widespread use of the term mini-stroke can inadvertently create a public misconception, leading many to believe that the condition is not serious. However, medical professionals consistently emphasize that a TIA is a warning stroke and a medical emergency. The potential for this terminology to obscure the true severity of the condition can lead to dangerous delays in seeking medical care. If symptoms resolve quickly, an individual might not recognize the gravity of what they experienced and thus fail to go to the hospital. This implies that imprecise language can directly lead to missed opportunities for critical intervention, potentially resulting in a much more full-blown and detrimental stroke event. Therefore, it is essential to convey that a TIA is a major warning rather than an insignificant event, underscoring the urgency of seeking immediate medical evaluation regardless of symptom duration. To truly understand what a TIA is, let's consider how your brain works. The brain is an incredibly complex organ that requires a constant, uninterrupted supply of oxygen and nutrients, delivered through a network of blood vessels. A transient ischemic attack occurs when there is a brief, temporary blockage of blood flow to a specific part of the brain. This blockage can also affect the spinal cord or the retina, the light-sensitive tissue at the back of your eye. The fundamental difference between a TIA and a full-blown stroke lies in the duration of the blockage and its outcome. In a TIA, the interruption of blood flow is fleeting, and critically, it does not cause permanent damage to brain cells or the brain itself. The blood clot or obstruction causing the TIA often dissolves on its own or gets dislodged before any permanent damage occurs. In contrast, a conventional stroke involves a prolonged blockage of blood flow, leading to lasting brain damage and potentially permanent disability. While the temporary nature of TIA symptoms might make them seem less alarming, it is precisely this transient self-resolution that serves as a vital warning. These blockages often arise from the buildup of cholesterol-containing fatty deposits, known as plaques inside arteries, a condition called atherosclerosis. These plaques can narrow the arteries, reducing blood flow, or they can rupture, leading to the formation of a blood clot. Sometimes a blood clot formed in another part of the body, such as in the heart, can travel to an artery supplying the brain and cause a TIA. The temporary nature of a TIA, where symptoms resolve without permanent brain damage, can create a false sense of security for many, leading them to dismiss the event. However, the underlying cause, whether it's a blood clot or atherosclerotic plaque, remains. The self-resolution of symptoms merely means the body temporarily cleared the blockage this time, but the vascular system has been compromised, making a more severe event highly probable in the near future. This is evidenced by the particularly high risk of a full-blown stroke immediately following a TIA. Therefore, the temporary nature is not a safe signal, but a serious red flag for underlying vascular issues. This report must emphasize that the transient nature of TIA symptoms is not a reason for complacency, but rather a critical window of opportunity for intervention and prevention. The temporary aspect is a precious gift of time, not a sign of safety. Recognizing the signs of a TIA is paramount, and fortunately, there's an easy-to-remember acronym that can help you act quickly: F.A.S.T. It's important to note that these are the very same symptoms you would see in a full-blown stroke, which is why immediate action is so essential. Let's break down what F.A.S.T stands for. F is for face drooping, and you should ask the person to smile. observing closely if one side of their face droops or feels numb, as their smile might appear uneven or lopsided. A is for arm weakness, and you should ask the person to raise both arms straight out in front of them, checking if one arm drifts downward or feels weak or numb, as they might have difficulty lifting their arm or keeping it raised. S is for speech difficulty, and you should ask the person to repeat a simple phrase, such as "the sky is blue," and observe if their speech is slurred, garbled, or difficult to understand, or if they are struggling to find the right words, or seem to have trouble comprehending what you're saying. T is for time to call 911, and if you observe any of these signs, even if they seem to improve or disappear completely, it is imperative to call 911 immediately. Make a note of the exact time the symptoms began, as this information is critically important for medical professionals in determining the best course of treatment. Beyond the F.A.S.T acronym, other sudden symptoms can also indicate a TIA. These include sudden loss of vision or blurred vision in one or both eyes, double vision, sudden dizziness, loss of balance or coordination, confusion, or a sudden severe headache with no apparent cause. Remember, the key characteristic is that these symptoms come on suddenly. A person can also experience more than one TIA, and the symptoms may be similar or different depending on the specific brain region affected by the temporary blockage. The most crucial thing to remember is, do not wait to see if the symptoms improve on their own. Call emergency services immediately. Multiple sources consistently affirm that TIA symptoms are identical to those of a full-blown stroke. This means that, from the perspective of a layperson, there is no way to differentiate between a TIA and an ongoing stroke based solely on the symptoms at the moment they occur. The only distinction, whether the blockage resolves quickly on its own and causes no permanent damage, can only be medically confirmed after the event. This inherent ambiguity at symptom onset creates a significant diagnostic challenge for the public. Therefore, the script must strongly convey that the F.A.S.T acronym is not just for stroke, but also for TIA, and that any appearance of these symptoms warrants an immediate emergency call, regardless of how quickly they might disappear. Self-assessment of severity is dangerous. You might be wondering, if TIA symptoms disappear, why is immediate emergency medical care so crucial? The answer is simple. A TIA is a powerful and unmistakable warning that a full-blown stroke may be imminent. The risk of having a stroke is particularly high immediately after a TIA. Studies show that up to 20% of people who experience a TIA will have a stroke within 90 days. And half of those strokes occur within just 2 days of the TIA. Looking at the broader picture, approximately 1 in 3 people who have a TIA will eventually have a full-blown stroke in the future. This is precisely why immediate medical evaluation is not just recommended, but absolutely essential. Getting to the hospital right away, ideally within an hour of symptoms starting, allows healthcare professionals to identify the underlying cause of the TIA and pinpoint any treatable conditions that could lead to a future stroke. By addressing these conditions promptly and aggressively, doctors can help you significantly prevent a potentially devastating stroke in the future. Once you arrive at the hospital, the medical team will use various diagnostic tools to understand what happened and assess your risk. This typically begins with a thorough physical and neurological exam, where doctors will check your vision, speech, muscle strength, and reflexes. They may also use a stethoscope to listen to the main arteries in your neck for any unusual whooshing sounds, which could indicate artery narrowing. Imaging tests are crucial for getting a clear picture. A magnetic resonance imaging, MRI, or computerized tomography, CT, scan of your brain can reveal any damage or blockages. Carotid ultrasonography is often performed to check blood flow through the large arteries in your neck that supply blood to your brain, looking for any narrowing or blockages due to plaque. And echocardiography, which uses sound waves to create images of your heart, may be done to see if a heart issue, such as a blood clot forming in the heart, could be the source of the problem. Additionally, blood tests will be conducted to check for underlying risk factors like high blood pressure, high cholesterol, or diabetes. The high and immediate risk of a full-blown stroke after a TIA transforms a TIA from a singular event into a critical, time-sensitive diagnostic and preventive opportunity. The core purpose of seeking urgent medical care is not merely to confirm that a TIA occurred, but to swiftly identify and aggressively treat the underlying conditions that caused it before a more severe stroke can happen. Thus, the battery of diagnostic tests are not just tools for retrospective diagnosis, but essential proactive interventions aimed at averting future damage. This represents a crucial shift in medical strategy, moving from reactive treatment to immediate predictive prevention. This report must emphasize that the hospital visit after a TIA is fundamentally a critical step in preventing a stroke, not just recovering from a mini one. It is an investment in future health, leveraging a vital warning sign to potentially prevent a larger, more devastating crisis. Understanding what caused your TIA, and more importantly, what increases your individual risk, is a critical step toward effective prevention. The underlying cause of a TIA is often similar to that of an ischemic stroke, a temporary disruption of blood flow to the brain, typically due to a blood clot or the buildup of fatty plaque in an artery. Some risk factors are inherent and beyond your control. While you can't change them, being aware of them can motivate you to manage the factors you can control. Your risk of TIA and stroke increases with age, particularly after age 55. Your risk may be greater if one of your family members has had a TIA or a stroke. Men have a slightly higher risk of TIA and stroke, although the risk for women increases with age. If you've had one or more TIAs, you are significantly more likely to have a stroke in the future. Sickle cell disease, also known as sickle cell anemia, can lead to abnormally shaped red blood cells that carry less oxygen and tend to get stuck in artery walls, affecting blood flow to the brain. Stroke is a frequent complication, but proper treatment of sickle cell disease can help lower this risk. Fortunately, many significant risk factors are within your ability to actively control or manage through medical treatment and lifestyle choices. High blood pressure, hypertension, is one of the most important controllable risk factors, with stroke risk beginning to rise at blood pressure readings of 140 to 90 millimeters of mercury, millimeters Hg, and higher. Effectively managing blood pressure through lifestyle adjustments and medication is crucial. High cholesterol, which involves the buildup of cholesterol-containing plaques in arteries that can narrow them, can be managed by eating less cholesterol and unhealthy fats, especially saturated and trans fats, to help reduce these plaques. If diet alone is insufficient, your doctor may prescribe cholesterol-lowering medication. Cardiovascular disease is a broad category that includes various heart conditions such as heart failure, certain heart defects, heart infections, or irregular heart rhythm conditions like atrial fibrillation, AFib. Atrial fibrillation, in particular, can cause blood clots to form in the heart, which can then travel to the brain. Carotid artery disease is a condition where the large blood vessels in your neck that supply blood to your brain become narrowed or clogged due to plaque. Diabetes accelerates and worsens the process of atherosclerosis, which is the narrowing of arteries due to fatty buildup, thereby significantly increasing your stroke risk. Smoking, including exposure to secondhand smoke, significantly increases the risk of blood clot formation, raises blood pressure, and contributes to atherosclerosis. Quitting smoking is one of the most effective steps you can take to reduce your risk. Physical inactivity contributes to many other risk factors, including obesity, high blood pressure, and high cholesterol. Regular physical activity is vital for overall cardiovascular health. Poor nutrition, a consistently unhealthy diet high in unhealthy fats, cholesterol, and sodium, contributes to plaque buildup in arteries and high blood pressure. Heavy alcohol consumption can lead to high blood pressure and can negatively interact with certain medications. Obesity, being overweight or obese, especially carrying excess weight around the abdomen, significantly increases the risk of high blood pressure, diabetes, and cardiovascular disease. Obstructive sleep apnea, a sleep disorder characterized by repeated pauses in breathing during sleep, is a known risk factor for TIA and stroke, often contributing to high blood pressure. Lastly, illicit drug use, such as cocaine and methamphetamine, is known to increase the risk of TIA and stroke. The list of controllable risk factors reveals a strong degree of interconnectedness. For instance, obesity is clearly linked to increased risks of high blood pressure, cardiovascular disease, and diabetes. Similarly, poor diet and physical inactivity are major contributors to obesity, high cholesterol, and high blood pressure. This indicates that these factors are not independent variables, but rather components of a broader overall health profile. The primary underlying pathological mechanism for many of these factors is atherosclerosis, suggesting that improving one area often has positive ripple effects on others, leading to cumulative benefits for stroke prevention. This report should emphasize a holistic approach to health management. Rather than viewing each risk factor as a separate problem, viewers should understand that adopting a generally healthy lifestyle, e.g., regular exercise, balanced diet, can simultaneously address multiple risk factors, leading to synergistic benefits for stroke prevention. Atrial fibrillation, AFib, and obstructive sleep apnea, OSA, are specifically highlighted as risk factors. AFib is a major source of blood clots that can travel to the brain, and OSA can exacerbate other risk factors like high blood pressure. What makes these conditions particularly insidious is that AFib can be occasional or paroxysmal, with symptoms that come and go, and OSA is often undiagnosed because it occurs during sleep. This means individuals can be at high risk without obvious, continuous symptoms, making them silent contributors to TIA and stroke. This report should encourage viewers to proactively discuss all their health concerns, even those that seem minor or unrelated to cardiovascular health, like snoring or intermittent palpitations, with their doctor. This underscores the importance of comprehensive medical evaluation that extends beyond immediate TIA symptoms. The truly good news is that experiencing a TIA offers a critical and unique opportunity to prevent a potentially more devastating stroke in the future. The entire focus of TIA treatment and recovery is on actively managing the underlying conditions that caused it and implementing comprehensive strategies to prevent another, more severe event. This path forward involves several key components, often working in combination. Lifestyle changes are foundational and can significantly reduce your risk, acting as powerful preventive measures. You should adopt a heart-healthy diet, focusing on significantly reducing saturated and trans fats, cholesterol, and salt, and instead, building your diet around plenty of fruits, vegetables, and whole grains, similar to the highly regarded Mediterranean diet. This approach helps reduce plaque buildup and manage blood pressure. Engaging in regular physical activity is also crucial, aiming for at least 150 minutes of moderate-intensity cardiovascular exercise each week, which can be as simple as brisk walking. Regular physical activity helps lower blood pressure, improves your cholesterol profile by increasing good cholesterol, and contributes to weight management. Always consult your doctor to determine the safest and most effective exercise regimen for your specific health status. Quitting smoking is arguably one of the most impactful steps you can take. Tobacco use dramatically increases the risk of blood clots and contributes to artery hardening, and quitting significantly reduces your risk of stroke and many other serious health complications. Maintaining a healthy weight is important, as being overweight or obese significantly increases your risk for many conditions that contribute to TIA and stroke, including high blood pressure and diabetes. Strive to achieve and maintain a healthy body mass index, BMI, between 18.5 and 24.9. And for men, aim for a waist circumference of 40 inches, approximately 101 centimeters or less. And for women, 35 inches, approximately 89 centimeters or less. Limiting alcohol consumption is advised. If you choose to drink alcohol, do so in moderation, which typically means no more than 1 drink per day for women and 2 drinks per day for men. Heavy alcohol consumption can raise blood pressure and potentially interact negatively with certain medications. Prioritizing quality sleep is also key, aiming for 7 to 9 hours of quality sleep each night. If you experience symptoms like loud snoring or frequent pauses in breathing during sleep, you might have obstructive sleep apnea, and discussing this with your doctor is important, as treating sleep apnea is a crucial step in reducing your stroke risk. Finally, effectively managing stress is vital, as chronic stress can contribute to high blood pressure and other cardiovascular risk factors. Find healthy and sustainable ways to reduce and manage stress in your daily life. Regarding medication strategies, your doctor may prescribe medications specifically designed to prevent blood clots and manage existing risk factors. Antiplatelet drugs such as aspirin, clopidogrel, often known as Plavix, or ticagrelor, Brilinta, work by making your blood platelets less sticky, thereby reducing their likelihood of clumping together to form dangerous blood clots. For TIA or minor stroke, a combination of aspirin and another antiplatelet medicine may be prescribed for a period. Blood-thinning medicines, anticoagulants, these powerful medications, which include warfarin, Jantoven, or newer direct oral anticoagulants like dabigatran, Pradaxa, rivaroxaban, Xarelto, apixaban, Eliquis, and edoxaban, Savasa, reduce the overall clotting ability of your blood. They are often prescribed for conditions like atrial fibrillation, where blood clots are a significant concern. For medical procedures when necessary, for individuals with severe blockages in the arteries supplying blood to the brain, your doctor may recommend specific medical procedures to restore adequate blood flow. Carotid endarterectomy is a common surgical procedure for severe carotid artery disease. The surgeon makes an incision in the front of the neck, opens the blocked carotid artery, and carefully removes the accumulated plaque. The artery is then repaired. Carotid angioplasty and stenting is a less invasive procedure, often considered for blockages that are difficult to reach with traditional surgery, or for patients with other health conditions that make surgery too risky. It involves guiding a thin tube, called a catheter, to the narrowed artery. A tiny balloon at the tip of the catheter is inflated to widen the artery, and then a small metal mesh tube, called a stent, is placed to help keep the artery open and prevent it from narrowing again. Your ongoing collaboration with your healthcare team is paramount for follow-up care and consistent adherence. It is absolutely essential to attend all scheduled follow-up appointments and, most importantly, to strictly adhere to your prescribed medication regimen. Never stop or adjust your medications without consulting your doctor first, even if you feel well. Remember, it's the powerful combination of medication and committed lifestyle changes that truly makes a difference in preventing future strokes, not just one factor alone. Addressing emotional impact is also a crucial part of recovery. Experiencing a TIA can be a deeply unsettling event, often leading to feelings of shock, anxiety, and even depression. It's normal to feel anxious about your health, sad, or to experience unusual fatigue afterward. It is incredibly important to recognize these emotional shifts and to talk openly about your feelings with trusted friends, family members, or a healthcare professional. Seeking counseling or joining a support group can also provide invaluable emotional support as you navigate your recovery journey and adjust to new health management routines. Research indicates a multifaceted approach to TIA recovery and stroke prevention, encompassing extensive lifestyle changes, various pharmacological interventions, and specific surgical interventional procedures. A crucial observation is the explicit statement. It's the combination of these factors that's working, not just lifestyle alone. This indicates that no single strategy is sufficient for optimal prevention. Instead, maximum protective efficacy is achieved through the synergistic interaction of all these elements. For example, while medication adherence is critical, its effectiveness is significantly enhanced by concurrent lifestyle changes that address underlying disease progression and reduce overall cardiovascular burden. This implies an intricate interplay where each component reinforces and amplifies the benefits of the others. This report should convey that managing TIA risk and preventing future strokes is not a singular action, but a comprehensive, ongoing commitment. It requires the individual's active and consistent participation in close collaboration with their healthcare team, integrating diverse medical and lifestyle interventions for the most robust and sustainable outcomes. Beyond the immediate physical symptoms and future stroke risk, there are also post-TIA symptoms, including fatigue and emotional shifts such as shock or anxiety, feeling sad or empty, and even depression. While rehabilitation primarily focuses on stroke rehabilitation, it underscores the importance of psychological evaluation and treatment, counseling, and support groups for emotional adjustment, and notably states that motivation, mood, adherence to activities significantly influence rehabilitation outcomes. This highlights that the psychological and emotional aftermath of a TIA, even in the absence of permanent brain damage, can be substantial. If left unaddressed, this emotional burden, examples anxiety, depression, fatigue, could directly impact an individual's motivation and ability to adhere to crucial long-term medication regimens and lifestyle changes, thereby indirectly increasing their future stroke risk. This report should validate the emotional experience of those who have had a TIA and emphasize that seeking mental health support is not merely a secondary concern, but a legitimate and important part of the overall recovery and prevention strategy. A transient ischemic attack, or TIA, is a powerful and unmistakable warning from your body. While its symptoms may be temporary and fleeting, the profound message it carries is permanent. You are at high risk for a full-blown stroke. But this warning also presents a profound and invaluable opportunity. By understanding the critical signs, acting immediately by calling 911, and committing to proactive prevention strategies through dedicated lifestyle changes, consistent medication adherence, and necessary medical procedures, you can significantly reduce your risk and truly empower your health journey. Do not let the mini stroke lull you into complacency. Take this warning seriously, work closely and consistently with your healthcare professionals, and prioritize your brain health as the foundation of your life. Your future health and independence depend on the informed and proactive steps you choose to take today. Since a TIA, by definition, causes no permanent brain damage, yet is a strong predictor of a future potentially devastating stroke, it serves as a crucial second chance, or a profound wake-up call. Unlike a full-blown stroke, which often leaves irreversible damage, a TIA provides a critical window where significant and effective preventive measures can be initiated before permanent neurological injury occurs. The repeated emphasis on immediate medical evaluation to pinpoint treatable conditions and thereby prevent a stroke clearly highlights this unique opportunity for proactive intervention. This implies that a TIA, although alarming, is a gift of time to alter a potentially grim health trajectory. This report should frame a TIA not as a misfortune or a minor inconvenience, but as a pivotal moment. A critical opportunity for viewers to take control of their health trajectory and proactively work to avert a more severe and life-altering outcome.